Hello and welcome to another edition of Wellbeing on Spectrum Television. Wellbeing is an interactive program designed to encourage a healthy living. My name is Mary Joseph. Please do well to follow us on all our social media platforms at Spectrum TV, or you can visit our website at spectrumtv.ng to be a part of the family. As the world joins hands to mark this year's World AIDS Day with the global theme, Let Communities Lead, and domesticated in Nigeria as communities' leadership to end AIDS by 2030. It reflects the country's recognition of the importance and significant role of community leadership in driving the much-needed goals and targets for ending HIV and AIDS by 2030. Communities are people living with or at risk of HIV and AIDS, leading the front line of progress in the HIV response. They work alongside donor partners, governments, public health systems, and other societal institutions for the success and sustainability of the global response to HIV and AIDS. In Nigeria, these communities have been making a difference, particularly in hard-to-reach areas where access to modern healthcare services is limited. They face barriers of inequalities and experience stigma and discrimination that constrain access and uptake of HIV and AIDS, tuberculosis services, and other health-related issues. Community-led interventions held in Nigeria are often spearheaded by organizations like the Network of Persons Living with HIV and AIDS in Nigeria, NEPWAN, Association of Women Living with HIV and AIDS in Nigeria, ASHWAN, and the Association of Positive Youth, APIN. We also have International Community of Women Living with HIV and AIDS in West Africa and others. They all support the implementation of global and national strategies in HIV response. And according to the Global Fund statistics, community organizations in Nigeria reach more than 1 million people with HIV and AIDS testing and counseling alone in 2020. These organizations also distributed over 5.5 million condoms and provided support to thousands of people living with HIV and AIDS. Well, according to this year's theme, it is time for that community to lead. But there are also some barriers to communities' leadership roles. Yes, these challenges, they do exist and they need to be removed. Well, this will be the focus of our discussion on today's episode of Wellbeing. Don't forget to connect with us on all our social media platforms at Spectrum TV, or you can visit our website at spectrumtv.ng live to stay engaged with our vibrant community. But before we delve straight into this conversation, let us just quickly take this short break. We'll be right back.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you'd have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions on Wellbeing, your wellness talk show. Wellbeing airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
You're welcome back to the show. It's still the program Wellbeing, your wellness talk show that is designed to keep you health conscious. Do remember to follow us across our social media handles at Spectrum TV, or you could visit our website at spectrumtvlive.ng to be a part of this family. Before I went on that short break, I introduced the topic of discussion for today's episode, which is centered around the World AIDS Day, with the theme Communities Leadership to End AIDS by 2030. And this theme holds immense significance as it calls for collective action and community-driven efforts to tackle the ongoing challenges posed by HIV and AIDS. Now, joining me to talk more about this is Mr. Esau Fabian. He is the Principal Program Officer, National Agency for the Control of AIDS, NACA. And I also have with me Ms. Favor Umoinang, who is the Project Officer, Drug Free and Preventive Healthcare Organization, DAFO. And both would be joining me virtually. And it's good to have you join me on the program.
Thank you for having me.
All right.
Thank you for having me. Good afternoon.
All right. So now I will start with you, Mr. Fabian. Now this theme, the theme for this year's World AIDS Day is Let Communities Lead. And for us in Nigeria, we domesticated the theme to community leadership to end AIDS by 2030. Now I'll start with you. How does community leadership play a vital role in the global efforts to end AIDS as a public health threat by 2030?
Okay. Good afternoon once again. Community taking the lead to end AIDS by 2030. That is the national team for the World AIDS Day 2023. It says that a community that is leadership to end AIDS by 2030. Now, in Nigeria, when we refer to communities, we are looking at people living with HIV, people at the risk of acquiring HIV, people that are affected by HIV, now leading the front line of progress in the HIV response, working alongside with donor partners for sustainability of the global response to HIV. That is what we mean by it. It means that all these stakeholders, all these people, these community people, the network of people living with HIV and the others that are involved in the response, they have to come together, work in collaboration with the donor partners, as to be sure that these messages, the services, is being propagated even to hard to reach environment, so that at least all these services will help to cut down or to stand down the prevalence rate or the level of a new incident within the community.
All right, so now talking prevalence, you mentioned something about it. Can you provide an overview of the progress made in reducing AIDS-related deaths since 2004? And statistically, HIV and AIDS has been with us for over 40 years. And can you tell us the prevalence of Akwa Ibom State, the current prevalence of new HIV infections across the world also?
All right, according to NICE 2018, the NICE report shows that the prevalence of HIV in Akwa Ibom State is 5.5%, and the national prevalence is 1.4%. And that shows that Akwa Ibom State has the highest prevalence rate of HIV in Nigeria.
So now, can we look at Nigeria's statistics globally?
The Nigerian statistic by estimation is 3 million population.
3 million population.
3 million by population, and then 1.4% of that population is by the NICE report shows that are people living with HIV.
So
that
now
means the prevalence rate of HIV in Nigeria is 1.4.
And in that 1.4,
after the NICE survey.
And in that 1.4, Akwa Ibom ranks number 1 with 5.5%.
Yes.
Okay.
Yes, according to the population in Akwa Ibom State.
Okay, so now I'm going to be shifting this conversation to Ms. Favour Umoinang. So can you tell me, in what ways can communities contribute to connecting individuals with the necessary treatment and also services to support and to fight against HIV and AIDS? As you are a program officer for the Drug-Free Preventive Organization, working with persons living and also being dependent with drug and drug use here in Akwa Ibom State.
All right, thank you. Thank you so much. And then I would like to say thank you to Mr. Fabian for that elaborate statistics. And thinking about how communities, like the national theme is communities leadership to end AIDS by 2030. So looking at how communities, the leadership in the communities can help us to achieve this broad goal is, okay, let's first talk about who communities, who is a community. Like community involves people that are living together, not just living together, but people that share common goals. Like a church is a community, like school is a community. Every gathering, a gathering of a particular group to achieve one purpose is a community. So now let's talk about community leadership to end AIDS in 2030. And then we would say that it involves people taking leadership in school environments, people taking leadership even in religious organizations, like pastors, prophets, coming down to acknowledge that AIDS is real, it has nothing to do with spiritual. Then educating people in that level, in a small group that you find yourself, in your work environment, take a leadership. Even in people, in social gatherings, taking leadership to understand that as AIDS is real, and then supporting people that are living with HIV, encouraging people to know their status, go for HIV prevention services, and even remain in care. And this also has to do with, the roles, like it goes back to mobilizing community members for gender equitable and social norms, and also gender equality in the uptake of HIV prevention treatments, and even remaining in care. Now we are talking about gender equality in accessing HIV services. Let's go back to men organization. Normally in our society, men believe that infection, illness, and disease is just for women. So it's very difficult for a man to understand that most men don't believe that HIV is real. It's even that it's possible for a woman to remain in care. Also, in fact, it's even better. It's common for a woman like to accept to test for HIV, also accept the result being positive or negative, and adhere to treatment and services. But a man believes that no, it's not possible. I'm not HIV positive. Men hardly accept HIV results. So that is the leadership we are talking about. The national goal is really emphasizing on taking the leadership to the extent that HIV is real, wherever we find ourselves, to advocate, and then to also campaign against stigmatization and discrimination for people living with HIV.
Now, the message that Ms. Favor just pointed out places community leadership at the center of HIV and AIDS plans, even in the programs and also the budgets, and even the monitoring efforts. So can you elaborate on the significance of this approach and its potential impacts when we are looking at Akwa Ibom?
You see, the 5 priorities for national or state HIV response is about achieving epidemic control. The epidemic control is more or less of a prevention, how the kind of prevention services that should be provided directly to the community. That is from wherever the source of this prevention services or intervention is coming from. They want it to be directed to the community. This is one of the priority area. Then the ability to reduce transmission from mother to children. Transmission from mother to children. Remember, there are many areas that is seen as a hard to reach environment where the services is somehow limited, because in the other way around there is a kind of poor navigations, inability of many of them to get to or to transport themselves to where the modern facilities that provided the services, the HIV services are located. And also we want a situation that community taking the lead that can be able to ensure that quality of care is being provided to people living with HIV, people affected with the virus, people that are of a risky behavior. Let there be a proper communication, that is social behavioral and the communication changes to them. And therefore there should be the possibility of these people that are providing the services, providing a quality data that we can be able to know that, oh, this is the situation, this is the prevalence rate, this is the achievement, this is what the challenges are. And then at the end of it, we in Nigeria, we fully depend on donor partners or international donors or funders that support all these activities. Okay. Now we are looking at the possibility handing over these services or these interventions to the community. The community involving the people living with HIV, the people at risk, that is the key populations, the orphans and the vulnerable children, and even the general populations. Then in this case, we are looking at all these people should be part of the services, so that at least they can be able to push these services even to where the implementing partners couldn't have reached. And also be able to bring either the drugs to the people that are living in those hard to reach environments. Okay. Because when you involve community mobilizers, peer educators, and otherwise in all these cases, definitely there will be full involvement, full service provision to the people that need the services. Now, and so those are the things that we are looking at, so that at each by the end of this, or by 2030, there should be nothing like AIDS-related death. There should be nothing like a new incident, either coming from a pregnant woman giving a vertical transmission to their children, or either through breast milk or whatsoever. So those are what we are looking at. If all these services are being carried out properly, following the 5 priorities areas for the response, then definitely we can be able to end AIDS. That is why we need community to take the lead. You know, whenever there is a community-led interventions, always have a massive achievement at the end of it, because they are the one that know where this thing is inching them.
Now, you said something about communities, persons living with HIV and AIDS, adolescent youth living with HIV and AIDS. But then again, there are still some current challenges, some barriers to affecting that particular community in the fight against AIDS. Now, how can all of these obstacles, we also have the issue of the anti-stigma and discrimination bill that is yet to be passed in Akwa Ibom State. Now, can you tell me, how do you see, or how can you envision all of these obstacles be removed?
Yes, when someone that is residing in a particular community is well sensitized and trained, is well equipped with the information around HIV as an epidemic. When the person is fully imparted with the knowledge about HIV, and the person is residing in a certain community where people around are ignorant of the information or the facts around HIV, it's likely that that person within that community can be able to easily sensitize the people around them. Remember, when we talk of community, we are talking of people that knows themselves. They inhabit in a particular environment, and they know themselves very well. And so they believe on information that they can easily receive because it's more or less a reality unto them, other than the ones that we broadcast. And then when all these informations are being shared by them, they can be able to clarify them. HIV is not a death sentence. HIV services are free. These are something that can easily be handled. They are free services. The testing is free. The treatment is free. And even there is possibility, currently people pick these drugs from the pharmacy or from the hospital, the facility pharmacies, and they take it to the community where they use it to do refilling of those ones residing in that community.
But then there are cases of funding.
Community people,
there are cases of funding. There's cases of low funding because budgets and also funding to provide adequate access to healthcare services like the drugs, antiretroviral treatment, even PrEP and PEP. Funding is still a challenge.
I think that is the area that we are looking at now. Considering the next alignment of the services that we are looking at, we are trying to see the possibility of handing over most of all these services to the community people, to the network, and to the other stakeholders that will help in this implementation. And on the course of it, it's already planned that there will be provisions for all those things in questions. And that is why we are looking at the community involvement, either in the church, the faith-based organizations can assist also in carrying out all this responsibility. They will be implementing alongside with the donor partners that will be doing the funding. So all these things is already on plan. In plan, and that is where we are looking at.
Okay, all right.
So all those obstacles of funding, the obstacles of the barrier of people accessing the treatment is something that be cut off. They will remove it.
All right.
So that is a plan that is already on ground.
Now, for the sake of emphasis, because we are running out of time, can you emphasize the importance of supporting these local programs led by persons living with HIV and AIDS and other preventive initiatives led by communities? What specific strategies would you advise, or do you think would be a proven initiative or a successful initiative in all of these areas?
Okay, one of those strategies I would say is an integration of people living with HIV communities into activities and opportunities in the community. Not sidelining persons that are living with HIV, even when it has to do with employment and social protection interventions, like engaging them in activity, understanding that people that are living with HIV and AIDS are also people that are part of the community. Like I heard a story about a particular woman,
Okay.
a particular teacher in a private secondary school. Okay, let me say proprietress that sacked a lady because she discovered she was an HIV positive. That is very, very wrong. So, and then I would like to say, while we are waiting for the domestication of the HIV stigma law in our private state to be rolled out, and we have the responsibility of still advocating, the civil society organization coming together, advocating to stakeholders, community leaders,
Okay.
to support the people that are living with HIV instead of discriminating and stigmatizing them at every point in time. All those things, all those discriminatory attitudes discourages people from even coming out to access services because they wouldn't want people to know that they are HIV positive.
Okay.
And in as much as they are hidden and then they are virally not suppressed, yes,
Okay.
because they are not on ARV.
Okay.
And then they keep on increasing the incidence cases of HIV within the community.
Okay.
So and then and to add to that, also ensures that there is a removal of forms of every form of gender and human rights barriers. Okay, just like we talked about that.
Okay.
Then getting to keep up, ensure that we remove every barrier to accessing health services for
Okay.
for population that are vulnerable,
All right.
women, young people, pregnant women,
Okay.
even people that are using and injecting drugs.
Miss Favor, thank you so
Yeah.
much. But finally, Mr. Fabian, I would always want to have this
Yeah.
conversation with you next time. But then again, I want to ask, do you think that Nigeria is ready and is actually on the map to ending AIDS by 2030?
Yes, I think with the step that we have taken so far, we are actually working towards achieving the vision of a zero new HIV infection, zero discrimination, and a zero AIDS related death.
All right. Thank
So
you
we
so
are
much.
believing that when the community led the HIV interventions to their different communities, we will oftenly be able to end AIDS by 2030.
All right. Thank you so much, Mr. Eso Fabian, and also Miss Favor Umoinang for being a part of today's conversation.
Thank you.
Thank you so much.
All right.
Thank you. We duly appreciate you.
Thank you so much. So I was speaking with Mr. Eso Fabian, the Principal Program Officer, National Agency for the Control of AIDS, NACA. And I also had with me Ms. Favor Umoinang, who is the Project Officer, Drug Free and Preventive Healthcare Organization, DAFO, as we commemorate this year's World AIDS Day by navigating through the intricate landscape of health and community engagement. Thank you so much for being a part of the show. Do remember that you could also be a part of this family by following us on all our social media platforms at Spectrum TV, or you can visit our website at spectrumtvlive.ng. Join us next week for another edition of Wellbeing. My name is Mary Joseph. Do enjoy the rest of your day.